Good morning. My name is Yusuf Tamer. I am a principal data and applied scientist at Parkland Center for Clinical Innovation. And at Parkland Center for Clinical Innovation at PCCI, we provide data analytics and predictive solutions to county health and human services, Parkland Health, and other community-based organizations.
Hi, my name is Nainesh Shah, and I'm a clinical assistant professor at UT Southwestern and a hospitalist in my clinical role at Parkland Health, which is one of the largest county hospitals in the country. It's based in Dallas, Texas, and I'm also a deputy medical information officer at Parkland Health and help with the clinical informatics team with informatics-related projects for the hospital and the health system.
The predictive and data analytics solutions that we provide is focused on unserved or underserved population of DFW Metroplex area and greater Texas area. So these populations have needs that is special to them and that needs to be met, especially in the healthcare setting. So providing care to them, providing data-driven care to them is critical and essential, especially in this era of AI and data-driven solutions. A short answer on how these predictive models or how these AI models can be important for the community is the timely and explainable AI is really crucial for these populations and overall for our healthcare system. So for example, for a respiratory failure patient, any second or any minute can change their health outcomes. Or for a septic patient, any hour that is delayed for their treatment can be deadly for their health outcomes. So these AI solutions, especially if they are explainable and if they are acted upon, can have greater impacts on health outcomes for our patient populations. So PCCI is a 501(c) nonprofit company which has spun out from Parkland Health as a nonprofit to serve unserved or underserved population of Dallas County and Texas. And our mission is to provide data, analytics, and predictive solutions for health systems, county, and different community-based organizations to improve health outcomes, to improve community education, and to provide data-driven solutions for these populations, and to increase their health outcomes. Parkland Health is our one of the biggest collaborator and partner, and we provide predictive solutions to Parkland Health to impact these populations.
Yeah, you know, Parkland Health is one of the largest county hospitals in the country, and we take care of the Dallas County population. The Dallas County population, unfortunately, has a lot of people that are uninsured or underinsured, and we are lucky enough to get some taxpayer money to help take care of patients that live in Dallas County, but we need to make sure that that money goes far. And we're lucky to have PCCI as a collaborator to help get data-driven initiatives so that we can help as many patients as we can, both in a preventative fashion as well as when they get acutely ill in the hospital itself. But with PCCI, we're trying to prevent hospitalizations. We're trying to really help patients get good health care so that they prevent getting ill. And PCCI has been a great collaborator for this, and with all of their analytics and data-driven approaches, we're able to come up with various programs that affect health outcomes.
One of the predictive solutions that we collaborated with Parkland Health is inpatient sepsis prediction. So sepsis is a blood infection where a timely solution is critical for patient's outcome, and we built a predictive model for better care of sepsis patients inside hospital. One of the population health program that we initiated with the help of our collaborators, Parkland Health and Dallas County Health and Human Services, we created a pediatric asthma dashboard, which through years helped decrease the ED visit utilization by the asthma patients. When we did an analysis on randomized control group, we found that we decreased the ED visit utilizations 35 to 40% of the pediatric asthma patients, which was a big improvement for their asthma status and asthma outcomes.
We really need an AI model for predicting sepsis because sepsis is such a big issue. We've known for quite some time now that sepsis is a leading cause of mortality. And we also know that every hour delayed in recognizing and treating sepsis can actually increase mortality, the odds of mortality, by 14%. So knowing how important and deadly sepsis is, and also knowing that if we catch it a little bit sooner, we'd be able to save lives, we really thought that an AI model for sepsis would come in handy, because if we had the assistance of these algorithms and the models, maybe we can catch sepsis even an hour, 2 hours, 3 hours earlier. And at that point, we're talking about saving many lives, not only at our hospital, but if this algorithm works, we can kind of disseminate this information and hopefully affect care throughout the world.
We built this sepsis prediction model utilizing initially through literature review, and then we collected information from Parkland Health's EHR system. We utilized vitals, we utilized lab results, we utilized prior history of different infections, and we also utilized demographics of the patient as well. And then we built this algorithm that can predict timely sepsis onset. So utilizing the diagnosis codes for sepsis, we are able to predict sepsis 20 on average 20 hours before the first order of antibiotics came in. So this was a initial and a big step for predicting sepsis in the inpatient setting.
AI is a black box for clinicians in a lot of respects, and there's different AI models out there. And we tried our best to open this black box for our clinicians, because we know in order to gain the trust of the clinician to take the advice of this AI model, they have to have some understanding as to why the model is predicting that this patient is going to have sepsis. And so we did our best through trial and error. We went through several iterations of trying to bring up the salient data points that the model is using to suggest that the patient has impending sepsis, and present that to the clinician so the clinician's aware of what data points were changing that actually triggered the model to suggest that the patient had sepsis. At first, we tried to bring up the 5 biggest data elements that the model had used to to surpass that threshold to suggest that the patient's having sepsis. And we realized that even those 5 individual data points alone, out of the context of the entire patient, weren't that helpful for clinicians to actually get an understanding of why this model was suggesting that the patient had sepsis. And so we asked PCCI to help uncover this or open up this black box even more, and they created this dashboard that we call islet. It's one page on the screen within the EHR. It's embedded within the EHR, so the clinicians don't have to go anywhere else. It lives within the EHR. As soon as the alert pops up saying, hey, this patient is at high risk of having sepsis in the next 24 hours, the clinician can click on this link, it opens it up within the EHR, and it brings all the salient data points that you would want all in one page so that the clinician can go through it. They see lab results, they see the vitals, and they see also the top contributors to why the model has predicted sepsis for this patient. So putting all of that together on one screen, otherwise what clinicians would have to do is they click around in the EHR to 10 different spots, and then in their mind they have to kind of put it all together. It's kind of like back in the day with the magic eye, where you have to really try hard to actually get a clear picture. What the islet does is it makes it so much easier to see that picture very clear, because all the data is there in one spot, and there's some component to why that model is suggesting that the patient had sepsis. So it's been a big, huge leap towards kind of opening up that black box for our clinicians.
And we achieved islet through collecting all the historical information for each patient that we are predicting sepsis on. And we put this in a context, like Nainesh mentioned, in a context where everything about the sepsis prediction, and even more with the lab results, is available in one page and easy to access by providers. And we are able to integrate this islet application with the Parkland's EHR, and we try to make it EHR agnostic so that we can utilize APIs and then integrate this islet application into different EHR systems as well. And islet is a dynamic dashboard visualization where all the information is updated every 15 minutes, where we do our predictions, and we collect the historical information, create visualizations so that clinicians can see trends of lab results, vitals, and they can also understand at certain point why the model is predicting high risk, or why the model is suggesting this person, this patient, is at risk in 24 hours or in 12 hours without seeing any visible symptoms.
Yeah, and the reason why it's important for the clinicians to understand, as Yusuf was mentioning, we're trying to predict sepsis well in advance, on average 22 hours before the clinician would otherwise start antibiotics and note the signs of sepsis. And so at the end of the day, the clinician's still responsible for their actions. And so the AI model firing and suggesting that someone is going to become septic 22 hours in advance, there still needs to be a lot of convincing for that clinician, right? The clinician can't just take the model's word for it, because at the end of the day, the clinician is responsible for the decisions and the treatment plan that they come up with. And so there needs to be some explainability so that the clinician actually has an understanding as to why this patient is at risk, and they can take the appropriate action based on that. If the model didn't have that explainability, it would not be very useful, because clinicians would have to just ignore it, because they can't just rely on something that they don't understand. They do need to have some understanding as to what's going on with why this model is suggesting that the patient has sepsis. AI models are very vital to health, IT, and healthcare in general. In today's day and age, we've seen a huge leap forward in the last year when it comes to AI models, to large language models. We know that we have a lot of room to grow when it comes to healthcare in terms of taking care of patients, and using and leveraging this technology can really aid us in helping prevent care and also or prevent disease, prevent patients from decompensating. There's huge there are many examples for how AI can create interventions and help interventions that we can take both in the hospital setting but also in a preventative care setting. And there's a lot of room for us to grow. I think we're still in the very early phases of understanding how we can use AI. As more explainability comes around with these AI models, I think it'll be a lot more informative and a lot more usable for healthcare systems throughout the world. And again, I think that really right now we're at this phase where AI is going to help and aid both clinicians and healthcare systems take care of populations as a whole. But I know there's a lot out there in terms of, is AI going to become the doctor? And I don't think we're there. We're quite far from that. I think at the end of the day, the AIs need to have explainability, and the clinicians are still going to be necessary to tie it all together and understand what's actually happening with the patient, be there at the bedside, and be able to actually implement whatever treatment plan is necessary with the assistance of the AI models that we have.
And Nainesh mentioned 2 points I also want to highlight. The AI models as data scientists and as the entrepreneurs, when we build these models, 2 things for me needs to be there in these AI models. One, they need to be timely. So if an action is going to be taken out of this outcome of this AI model, it needs to be timely, otherwise it loses its impact. And it is also needs to be explainable. Like Nainesh mentioned, clinicians needs to know and before making an informed decision. So as the builders of these AI models, we need to keep that in our minds, that all the model outcomes or all the model inputs are visible to clinicians, and they can easily digest that information so that when they are making their decision, the model is a plus factor for them. Model is a impactful, helpful decision support system for the clinicians, and they know why the outcome is predicted that way.